Welcome you all back to the 4-week course on digital orthodontic workflows. In this part of the lecture, we'll be seeing about the fundamentals of digital cephalometry, interpretation, and clinical applications in orthodontics. So let us first know what is the importance of cephalometry in orthodontic diagnosis. It provides an accurate skeletal diagnosis for the patient in assessing class 1, class 2, class 3 skeletal malocclusions and to detect any differences in growth patterns and discrepancies. It helps in dental relationship assessment. It helps in measuring the incisor inclination angulation, identifying the crowding spacing and other compensations that are present within the arches. It helps in identifying the growth prediction and monitoring by taking serial radiographs. It helps us in treatment planning. It provides a guide in applying selection and biomechanics, and it predicts the treatment outcome and stability. Also, it provides details about post-treatment evaluation of the patient. It confirms the achievement of skeletal and dental goals. So, for example, if in case we had planned a particular treatment modality in a class 2 patient and we have pre and post-op radiographs, this helps in assessment of the desired post-treatment change that was planned before the start of treatment. Also, it is useful in retention and long-term follow-up of cases. Apart from these, which help in diagnosis and treatment planning, it also helps in interdisciplinary collaboration, meaning which it helps the surgeons and orthodontists together to plan orthognathic surgical cases, and it helps support clear communication with surgeons and restorative dentists in other cases. Let us now see the evaluation of cephalometric radiography in orthodontics. So it all started with Broadbent and Hoffer, who first introduced the cephalometric radiograph using standardized lateral skull radiograph. So then the Bolton standards were introduced where cephalometric norms were introduced for growth studies. Then the manual tracing using acetate papers on radiographs were introduced. But this manual tracing is a time consuming process. For a beginner, a manual tracing might even take up to a day or two. Then came the digital radiography, wherein digital radiographs were made, which now made the job much easier for storage, sharing, and manipulation of the film. With the help of these digital radiographs, then in 2000, digital cephalometric softwares were introduced, which helped in two-dimensional evaluation of the two-dimensional radiographs. It provided automated measurements and it also provided growth simulations and treatment prediction on two-dimensional radiographs. 10 years later, three-dimensional cephalometry was introduced on CBCTs. So this provides a more accurate spatial analysis in a three-dimensional aspect. Also, it helps in evaluation of asymmetries that are there in the jaws, any issues with the temporomandibular joint, and the airway analysis as well. So now, as we all know, the whole world is now shifting towards the AI integration. So here again in cephalometry, there are softwares that use the AI for automated landmark detection and remote diagnosis and virtual treatment planning as well. Okay, like in all cases, we first started with manual and now digital and now the AI. Why do you think is digital cephalometry a better option than doing a manual cephalometry? The first thing is it is highly accurate and it gives us consistent results. So the possibilities of human error is much reduced here. Since it is automated and AI assisted, there are less chances for error in the measurements and the identification of the cephalometric points. It provides a faster analysis. You don't have to work for the whole day, keep tracing. Instead, the software, once either it is a semi-automated or a completely automated version, you either have to mark points or you have to basically calibrate this ceph so that the software can help you in marking the points. Next, the easy storage and sharing options, because the digital platforms, as we all know, since it comes with the cloud storage, the digital files can be securely archived and instantly shared with any fellow dentist. There is no risk for physical damage or loss. Also, it provides an enhanced visualization wherein you can identify the soft tissue and the hard tissue features more accurately by changing the brightness and contrast of the radiographs. Also, it helps us in growth monitoring and treatment planning in a three-dimensional aspect as well by providing simplified superimposition in the software and accurate tracking of skeletal and dental changes over time. So, first, let us see how the two-dimensional radiographs are used in orthodontic diagnosis. So, here are examples of few digital two-dimensional radiographs that are used in orthodontic diagnosis. The extraoral radiographs, which include the lateral ceph. This lateral cephalometric can be used in identification of vertical and anteroposterior discrepancies in the jaws. The next one is the frontal cephalometry, which utilizes two planes, the transverse and the vertical planes. Then we have the orthopantomogram, the OPG, which again helps us visualizing the jaws, the TMJ. Next, we have the hand wrist radiograph that can be utilized in identification of the growth status of an individual. And finally, we have the MP3 radiograph, which again helps us in growth estimation in patients. Coming to intraoral radiographs. Intraoral radiographs, we basically go for two intraoral radiographs in most of our cases, one of which is a RVG, the intraoral periapical radiograph, and the other one is an occlusal radiograph. So these provide details about the root length, the periodontal status, and the position of any unerupted tooth.